Have you ever felt like you're missing some pieces of a puzzle?
Uh, like when you're trying to understand something.
Yeah. Like trying to understand the world around you.
Yeah, I get that.
Well, for people with autism, those pieces, they might fit together just a little differently.
So it's like their puzzle makes a different picture.
Exactly. It leads to like a totally unique way of experiencing life.
That's so interesting.
And that's what we're doing today.
We're putting together a puzzle.
In a way, we're doing a deep dive into the world of autism.
We're going past all those like common misconceptions about autism.
Yeah, and we're going to uncover like a much deeper understanding of this complex condition.
It is a complex condition for sure.
And there's so much more to it than most people realize.
Definitely. Even though there's more and more awareness these days, myths and stereotypes, they still kind of stick around.
That's true.
And our goal today is to, well, we want to give you the knowledge to challenge those old ideas.
And we want to paint a clearer picture of what autism really is.
I like that analogy, a clearer picture.
Thanks. Oh, and before we forget, we want to give a huge thank you to London Heartbeats Z Academy.
They're in the UK, right?
Yep. They've given incredible support in putting this deep dive together.
They're awesome.
They are. And if you want to learn even more, you should definitely check out their courses.
They have over 150 of them.
I know, it's amazing. Right?
Yeah.
And don't forget to follow them on social media, too.
All the usual spots: Facebook, Instagram, Spotify, and YouTube.
That's right. You can get a regular dose of awesome content completely free.
Free is always good.
You won't want to miss future discussions like this one. Okay, so let's get down to business.
Time to define autism.
Yeah, got it. It's essentially a developmental disorder.
So it affects how people develop.
Exactly. And it primarily affects how people communicate.
And how they interact with everything around them.
Exactly. So it affects how they interact with the world around them.
Makes sense.
And think of it this way. It's like a different way of processing information.
Process.
Yeah, and experiencing sensory input.
Like how they see, hear, and feel things.
Exactly.
So that can lead to like a lot of different characteristics and behaviors,
It
right?
can. And some of those behaviors might seem unusual to people who don't experience the world in the same way.
I can imagine that.
And one of the most important things to remember is that autism is not a one-size-fits-all diagnosis.
What do you mean?
Like, everyone with autism is different.
Oh, right.
It's a spectrum, so it shows up differently in each person.
So there's no like one set of behaviors you can point to.
Exactly. Some people with autism might engage in repetitive behaviors.
Like what kinds of behaviors?
Well, some common ones are hand flapping or toe walking,
Interesting.
while others might have, like, unusual speech patterns.
Some I might like echo phrases.
Exactly. Or even speak in a monotone.
And it's so fascinating because these behaviors, they might seem different to us.
But they actually often serve a purpose for the person with autism.
Like they're not just doing those things randomly.
Right. It might be a way of self-soothing.
Makes sense.
Or it could be a way of expressing their emotions.
Or maybe even processing sensory information.
Exactly. For example, imagine a child lining up their toys in a specific order.
Okay, yeah, I can see that.
Or they might constantly flip objects over and over.
That might seem unusual to some people.
It might. But for a child with autism, this could be their way of creating order and predictability in their environment.
And that can be really comforting for them.
Absolutely. It's like their way of making sense of the world around them.
Which makes it super important to understand the reason behind the behaviors.
Right. Rather than simply labeling them as odd or inappropriate.
We need to go deeper than that.
We do. And this brings us to the concept of symptoms.
So we're moving from behaviors to symptoms.
Yeah. These are the challenges that individuals with autism might face as a result of their unique way of experiencing the world.
So the characteristics are part of what makes them unique.
Right. And the symptoms are the areas where they might need some extra support to navigate the world.
So support is key.
It is. And some common symptoms include things like difficulties with social interaction.
Like understanding social cues.
Yeah. And also communication breakdowns.
That must be frustrating.
It can be. And they can also have trouble adapting to change.
So routine is important for them.
It can be. And that's why early screening and diagnosis are so important.
So we can identify those challenges early on.
Exactly.
And then give them the right support and interventions to help them thrive.
Exactly. Screening usually involves observing a child's behavior and development.
Like looking for those little signs that might point to autism.
That's right. And we need to emphasize that only a qualified healthcare professional can make a diagnosis.
Of course. A doctor needs to be involved.
Absolutely. Now let's dive into the causes of autism.
This is where it gets really complex, right?
It does. There's no easy answer. It's probably a mix of genetic and environmental factors.
Like a nature and nurture kind of thing.
Exactly. But researchers are still trying to put all the pieces of the puzzle together.
It's an ongoing mystery.
It is. But one thing's for sure. Each person's experience with autism is unique.
That makes sense.
Now, one thing that really struck me is how we've moved away from putting autism into different categories.
You mean like Asperger syndrome or autistic disorder?
Exactly. We used to classify it like that.
Right, with those separate subtypes.
But now we recognize it as a spectrum disorder.
So it's more inclusive now.
Much more. And this shift is crucial because it recognizes that there's so much diversity within the autistic community.
And it helps us move away from those rigid labels.
Right. Those labels might not really reflect a person's individual experience.
So instead of focusing on specific types,
We now understand autism in terms of the levels of support a person needs.
so there are different levels of support.
There are. Our sources describe 3 main levels.
What's the first level?
Level 1 is requiring support.
Yeah.
Individuals at this level might face challenges with things like inflexibility,
Mm-hmm.
or they might need help with organization planning.
So like executive functioning skills.
Yeah, exactly. And they might also have some difficulty with social skills.
And making friends.
That too.
What about level 2?
Level 2 is requiring substantial support.
So they need more support than level 1.
Right. At this level, the difficulties with verbal and nonverbal communication are more obvious,
I see.
and social interaction is more limited.
What about repetitive behaviors?
Those may be more noticeable at this level too.
And then there's level 3.
Yes, level 3 is requiring very substantial support.
Wow, so this is the most severe level.
It is. Individuals at this level experience severe deficits in communication.
Both verbal and nonverbal.
Both. Their social interaction is very limited.
And they might even have difficulty expressing their basic needs.
That's right. It's important to understand that the autism spectrum is incredibly diverse.
And that individualized support is so important.
Couldn't agree more. But before we get into the historical classifications of autism like you mentioned earlier,
The ones that are outdated.
yeah, it's important to understand that our sources dive into those old categories to help us understand how we got to where we are today.
So it's all about context.
Exactly. It gives us a better understanding of autism as a spectrum.
Okay, that makes sense.
So one of the terms you might come across is pervasive developmental disorder, or PD.
PDB.
Yeah, it was a much broader category that doctors used before we started using ASD.
So this was before ASD was introduced.
That's
And
right.
what did it include?
Well, it included things like autistic disorder, Asperger's disorder, and PDD-NOS.
PDD-NOS? What's that?
NOS stands for not otherwise specified. It was used for people who showed some signs of autism, but didn't quite meet the specific criteria for any of the other diagnoses.
So it's kind of like a catch-all category.
You could say that. It was for those individuals who didn't fit neatly into the existing boxes.
So as our understanding of autism grew,
Those rigid categories got replaced with the broader spectrum model.
which is more flexible and allows for more individualization in diagnosis and support.
Absolutely. Our sources actually show how ASD absorbed those earlier diagnoses.
Like autistic disorder, Asperger's disorder, and PDD-NOS.
All of them. It really shows how our understanding of autism has evolved.
It's becoming more inclusive.
Exactly. There's another representation of PDD in our sources that breaks it down even further.
What do you mean?
It highlights all the different conditions that PDD used to cover.
Interesting.
And it even shows some key characteristics within autism itself.
Like what?
Well, it distinguishes between social language and repetitive behaviors.
I see.
And it even touches on intellectual disabilities, which can sometimes be present in autism.
Right. So speaking of specific types, let's talk about Asperger's syndrome.
Okay.
It's often mentioned when talking about autism.
It is.
So what was Asperger's syndrome exactly?
Well, it was characterized by difficulties with social interaction, repetitive behaviors, and unusual communication styles.
So it's similar to autism in some ways.
Very similar. But individuals with Asperger syndrome didn't have significant delays in language development.
Oh, so their language skills were typically okay.
Right. And our sources actually give some specific examples of these characteristics.
Like what kind of examples?
Well, things like unnecessary laughing and frantracting, lack of response to loud sounds, seeming fearless, and difficulty interacting with others.
Interesting.
They might also echo words, have strong attachments to objects, or experience feelings of loneliness.
And sometimes they might even have outbursts like saying, "Shut up."
Exactly. And while Asperger's is no longer an official diagnosis.
Right. It's all part of the autism spectrum now.
Exactly. But these characteristics can still be seen in individuals on the spectrum.
And they give us valuable insights into the challenges they might be facing.
So it's important to have empathy and understanding when interacting with individuals on the spectrum.
Because their behavior is often a reflection of their unique way of processing the world.
You got it.
And it's important to remember, even though we don't use the term Asperger's anymore, the challenges are real.
Yeah, the experiences of those individuals are still valid.
For sure. And they still need our understanding and support.
Absolutely. We need to see the individual, not just the label.
I like that, seeing the individual.
And speaking of labels, let's talk about some of the misconceptions about autism.
Oh, yeah, there are so many misconceptions out there.
There are. Like, one big one is that people with autism can't feel or express emotions.
Oh, that one's so wrong.
It is. It's a harmful myth.
People with autism experience the full range of human emotions.
Exactly. Just like everyone else.
They just might express them differently.
That's right. Our sources point out that some individuals might struggle to put those feelings into words.
So they might not be able to say how they're feeling.
Yeah, but they might express themselves in other ways.
Like what kind of ways?
Through physical gestures or even creative outlets like art or music.
Oh, that's interesting.
And sometimes even through specific behaviors.
So it's about recognizing those unique ways of expressing themselves.
It is. Communication isn't always about words.
Right. There's so many ways to communicate.
And another common misconception is that people with autism prefer to be alone.
Like they don't want social interaction.
Yeah, but that's not always true either.
Social situations can be tough for some people with autism.
They can be overwhelming. And they might need some time to recharge after being around people.
That makes sense.
But it doesn't mean they don't want to connect with others.
Right. Everyone needs connection.
Exactly. In fact, lots of individuals with autism actually really crave social interaction.
But maybe they just struggle with the whole social thing.
Exactly. All those unwritten rules and all those complex social cues can be really difficult for them to understand.
Yeah, I can see how that would be hard.
Imagine wanting to connect with people, but not knowing how to navigate all those subtle social
It
interactions.
would be so frustrating.
It would be. So it's important to be patient and understanding when interacting with individuals on the spectrum.
Patience and understanding are key.
They are. Now, our sources also talk about some potential risk factors associated with autism.
Like what kind of risk factors?
Well, they mention things like genetics,
So it could be inherited.
possibly. And they also mention advanced parental age.
Like if the parents are older.
Yeah.
But what makes the causes of autism so complex?
Well, it's probably a combination of things.
Like a lot of different factors all interacting with each other.
Exactly. Researchers are still working on figuring it all out.
It's a big puzzle.
It is. And it's important to remember that these are just risk factors.
Not guarantees that someone will develop autism.
Right. There are plenty of people with these risk factors who don't develop autism.
And vice versa.
Exactly. It just goes to show how unique each person's experience with autism is.
And how much more research we need to do.
Definitely. Unfortunately, individuals with autism can also face other challenges.
Like what?
Things like social isolation, bullying, anxiety, and depression.
Those are all serious issues.
They are. So it's crucial that we create supportive environments where people feel included and accepted.
And we need to reduce the stigma surrounding autism.
Absolutely.
Yeah.
And we need to provide resources to help people address these challenges.
What about support systems?
Support systems are essential, both for individuals with autism and their families.
So what kind of support is available?
Well, there are therapies like behavioral therapy, speech therapy, and occupational therapy.
And these therapies can be tailored to meet each person's individual needs.
Right. And our sources emphasize that while there's no way to prevent autism, early intervention is super important.
It can make a huge difference.
It can. It helps individuals develop skills and improve their overall quality of life.
What does early intervention focus on?
It focuses on developing communication skills, social skills, and adaptive behaviors.
Those are all important skills for navigating the world.
They are. So it's not about fixing autism.
Right. It's about giving people the right support to help them reach their full potential.
Exactly. And this brings us to a really important shift in perspective.
A shift in perspective.
Yeah. It's about moving away from seeing autism as a deficit.
And instead seeing it as a different way of being,
Exactly.
a different way of experiencing the world.
Right. It's about recognizing the unique strengths and talents that people with autism have.
And celebrating those differences.
Absolutely. Now, we've talked a lot about the challenges.
The challenges that people with autism face.
But I'm curious, are there any examples of how autistic thinking styles have led to breakthroughs?
Like in different fields.
Yeah, like, has autistic thinking actually helped us in some way?
That's a really interesting question.
It is.
It's important not to generalize, but there are definitely areas where autistic individuals often excel.
Well, like what?
Things like pattern recognition, attention to detail, and logical thinking.
And those skills are super valuable in lots of fields.
Especially in areas like technology, engineering, and mathematics.
So maybe instead of trying to fit everyone into the same mold.
We should embrace neurodiversity.
Exactly. It makes me wonder what amazing things people with autism could accomplish if their talents were recognized and supported.
The possibilities are endless.
They are. And it highlights the need for inclusive environments where everyone's unique perspective is valued.
Where everyone feels safe to be themselves.
Exactly. This deep dive has been really amazing.
Yeah, I've learned so much.
Me too. We've gotten to explore all the complexities of autism.
And we debunked some really harmful myths.
Yeah, for sure.
And we talked about how important it is to embrace neurodiversity.
And even though our sources gave us tons of info on autism, like its history and characteristics and causes and treatments.
There's one thing that really stuck with me.
What's that?
It's that idea of shifting our perspective, you know?
Like not seeing autism as something that needs to be fixed.
Exactly. It's just a different way of being.
A different way of experiencing the world.
Right. And we need to recognize the unique strengths and talents that individuals with autism have.
And celebrate those differences.
For sure. Think about all the areas where people with autism often excel.
Like pattern recognition.
Yeah, and attention to detail.
And logical thinking.
Those skills are so valuable.
In so many fields.
From technology and engineering to the arts and sciences.
It really makes you think,
about all the potential we're missing out on.
when we try to force everyone into the same mold.
Yeah, if we embrace neurodiversity, we could create a much more inclusive society.
And unlock all kinds of new possibilities.
From innovation and progress.
And it all starts with education.
With challenging our own assumptions.
And having those open and honest conversations about autism.
We need to move past stereotypes.
And embrace the fact that everyone experiences the world differently.
It's what makes us human. This deep dive has given me so much to think about.
Me too. And I hope our listeners feel the same way.
It's a reminder that understanding and acceptance are so important.
They're the first steps to creating a world that's more inclusive and compassionate for everyone.
Well said. And remember, this conversation doesn't end here.
Right. We want you to keep thinking about this.
Share your thoughts with others.
And keep the conversation going on social media.
Let's keep learning and challenging our assumptions.
And work towards a future where neurodiversity is celebrated, not stigmatized.
That's the goal.
Thank you so much for joining us on this deep dive into the world of autism.
It's been a pleasure.
We hope you learned a lot and that it gave you something to think about.
Until next time, keep diving deep.
See you then.